Hello and welcome to my weekly video blog, and today on A Vogel Talks Menopause I'm talking about 10 things you need to know about the post-menopause. If you like my tips and advice, then please subscribe and remember to hit the bell icon so you can be notified of all my new videos. I regularly talk about the perimenopause and the menopause, but I also want to talk today about postmenopause. There are things that every woman needs to know about what's going to happen to them. This stage will come, regardless of where you are at the moment. At some point, you're going to think, oh, I'm in the postmenopause. What do I do now? So I'm going to talk about situations where you can either be prepared for it when the time comes, because remember, knowledge is power, or if you're already postmenopausal, then hopefully this may help you to understand a little bit more, maybe some of the things that you're going through and you're not quite sure about. So number one, what exactly is postmenopause? It's really confusing because there are quite a few definitions out there. Some sources say you're postmenopause after 1 year. We tend to say 2 years just to give women that extra little bit of time, because periods can come back after a year or more. So in theory, we would say you are post-menopause after 2 years without periods. So how long does post-menopause last? So post-menopause starts 2 years after your last period and will basically last for the rest of your life. So after your estrogen has dropped, which is normally around about 2 years, that's the point where you are not likely to get pregnant. However, it's really important, if you have an active sex life, to still take care about sexually transmitted diseases, because apparently these are going up in women and couples over 50. Number 3 is symptoms don't suddenly disappear. I get so many women saying, I'm 2 years post-menopause and I'm still experiencing symptoms. So they don't just suddenly go 2 years on the dot. Some women find round about this point that their symptoms start to decrease, ease off, or stop. But for some women, it can go on for quite a few years afterwards. Sometimes some symptoms disappear, others may linger for that little bit longer. Number 4, if your symptoms are still going on, if they're still getting worse, or you're getting new ones, after round about the 5-year mark without any periods, then very often other health issues have started to creep in, and they are prolonging not the hormonal shift, but they are prolonging the symptoms that you may be experiencing. So if this is you, it's really important, ask your doctor to test you for low vitamin D, for underactive or overactive thyroid function, low vitamin B12, your iron levels. Even if you're not getting periods, you could still be low in iron, diabetes too, and also heart disease. All of these health issues can cause symptoms that can be confused with menopausal ones. So ruling these out so that you can continue looking after yourself is really important. Number 5, some symptoms don't disappear after the menopause, especially if you haven't done anything about them. So we know that in the perimenopause and menopause, joint aches and muscle aches and pains are a really common symptom. But what happens here is if you don't try and support your joints and muscles, then the deterioration can get to the point where it causes permanent damage. So certain symptoms, such as the joint pain, bladder issues as well, if you're starting to get an irritated bladder, that's unlikely to suddenly disappear. The dryness issue, so vaginal dryness, dry skin, dry eyes, dry mouth, these are unlikely to just suddenly disappear after the menopause. So the sooner that these appear, that you treat them, then the less likely they're going to linger for any length of time. And getting them sorted means that you're going to feel better as time goes on too. Number 6, how you feel post-menopause, and that's health-wise and also emotionally and mentally, often depends on how well you have taken care of yourself beforehand. The menopause, it's a huge trial for our bodies. It puts our bodies under a tremendous amount of pressure. And if we don't look after ourselves, then once we're into the post-menopause, we are going to be more vulnerable to all the other health issues that are associated with old age. So whatever point you are at the moment, if you want to have a good post-menopause, you need to start taking care of yourself now. A lot of women say to me, what's going to happen? How am I going to feel after the menopause? You feel different. It's a different phase of your life, but it can still be a good one. There's no reason why you can't feel as good in a different way. You don't have the monthly cycle to, churn you up every single month. And that can be great. I mean, I find for me is that I'm much more calm and leveled the whole time. There's none of this hormonal up and down every single month. A lot of women, once they've got everything under control, they do feel that they have a new lease of life. They can focus on different things now. They can prioritize themselves. They can end up doing something completely different. And it's interesting that a lot of new little businesses that start up here in the UK are all initiated by postmenopausal women. So there's a great deal to offer postmenopausal women out there, but you just need to grasp it and have a go if you like. It can be quite exciting. Number 7, as I mentioned before, the older you get, the more vulnerable you are to aging health issues. And for postmenopausal women especially, there's a couple of factors that you really need to look out for. That's osteoporosis. You can lose about 25% of your bone density as you go through the menopause. So that makes you much more vulnerable to fractures, to things like what we call it dowager's hump, where your spine can start to crumble. You can get much weaker joints, and that can end up leading on to arthritis too. So keeping your joints strong and healthy is really, really important here. So for the joints, you would be looking at weight-bearing exercises. You would be looking at making sure you're getting enough calcium and magnesium rich foods into your diet, and making sure you have enough vitamin D. Low vitamin D is so common in peri and menopausal women, and this is something that should be tested regularly. Just make sure, number 8, other symptoms that you can look at is high blood pressure. The one thing about high blood pressure, it seems to be that the more your estrogen falls, the more predisposed you could be to high blood pressure. It's called the silent disease because there are very few symptoms. And with women, especially post-menopause, very often the first indication of high blood pressure is a heart attack. So this is one, again, and especially if you're stressed and anxious, then that can affect your blood pressure. So this is one that should be tested regularly. I don't mean every single week you're going to put yourself under too much pressure, but maybe once every 6 months, just ask your pharmacist to check your blood pressure so that if something is going on, you can treat it before it deteriorates too further. Number 9 is still keep up all the basics. So that's your diet, your exercise, get plenty of rest. And one of the things about being postmenopausal is that many women are asked, you might be retired from work, but many women are asked to start being unpaid babysitters for their grandchildren. And that can very often lead to quite a lot of stress. So this particular one here, remember time for yourself. It's really important still to do some self-care when you're post-menopause, even if you're still looking after other people in the family. Remember to drink loads of water. It's really important here to keep your hydration up, because dehydration can affect all the areas of your health. It's hard work. You know, there are times when I just think, oh, I just don't want to do anything. But I know if I want to stay healthy into my old age, if I want to stay fit and do the things that I'm doing now, then I've got to put the effort in to look after myself. And it's still paying off at the moment, so fingers crossed. Number 10, don't forget these health checks. I've mentioned some of them. It's really important, because the older you get, the more likely you are to get health issues, and the sooner these can be looked at, the sooner any of them can be diagnosed, then the sooner they can be treated and got into control. So the annual checks would be things like blood pressure, get your eyes checked, and I know now my optician gets me in once a year just to check my eyes. If you're still at the age where you are being brought in for smears, don't ignore them. Still get these done. Make sure you get your dental checkups as well, and any other health screening that you would normally do. Don't forget these, because again, if they show anything up, you can get things sorted before they get out of control. So I hope you found this helpful. If any of you postmenopausal women out there are worried about other areas of your health, or if you're not sure about certain things, please ask and I will be happy to help. Any of you not at that stage yet that are worried about any specific aspects of postmenopause, and there's quite a lot of things I haven't covered, so maybe we will look at this, we'll look at more again shortly. Please let me know, and until then, I will see you next week for another edition of A Vogel Talks Menopause.